Good morning, everyone, and welcome. Today, we'll be diving into an important and intriguing topic, understanding hallucinogens and depressants. We'll explore their effects, the risks involved, and the social implications they carry. This presentation offers a comprehensive overview of these psychoactive drug categories, how they impact perception, their historical background, and the key safety concerns everyone should be aware of. Let's get started. When we talk about psychoactive drugs, hallucinogens and depressants stand out as two very different categories, each altering our conscious experience in unique ways. Hallucinogens mainly influence how we perceive and think, often causing shifts in sensory experiences and changing how reality is interpreted. On the other hand, depressants work by slowing down the central nervous system, which results in feelings of sedation, relaxation, and a decrease in overall stimulation. Despite these contrasting effects, both types of drugs deeply impact the way people perceive their environment and interact with the world around them. Hallucinogens affect perception by interfering with the way nerve cells communicate with neurotransmitters. This disruption leads to altered sensory experiences, such as seeing or hearing things that aren't there, a distorted sense of time, and shifts in how thoughts flow. On the other hand, depressants work by slowing down brain activity. They enhance neurotransmitters like GABA, which effectively slows nerve signals, causing drowsiness, muscle relaxation, and sedation. While both hallucinogens and depressants change how a person experiences reality, they do so through very different mechanisms in the brain. LSD was first discovered by Albert Hofmann back in 1938, but it wasn't until 1943 that its psychoactive effects were actually recognized. Fast forward to the 1960s, and LSD became a major part of the counterculture movement. People saw it as a way to expand their consciousness and dive deeper into spiritual experiences. There are quite a few myths surrounding LSD. Some of the most common ones claim that it causes permanent brain damage or leads to uncontrollable psychosis. However, scientific research conducted under controlled conditions hasn't supported these ideas. What really shapes the effects of LSD is a combination of dosage, the environment where it's taken, and the user's mindset. It's not inherently unpredictable or harmful, but these factors play a crucial role in how the experience unfolds. MDMA, also known as ecstasy, is a substance that many people recognize, especially in social and party environments. When it's in its purer form, it's often called Molly. What makes MDMA unique is that it combines stimulant effects with mild hallucinogenic experiences. This means users not only feel more energized, but also experience heightened sensations and emotional warmth, often leading to increased empathy and social connection. It's important to understand that while MDMA is popular at parties and festivals, it's not without risks. A common misconception is that it's completely safe, but that's not the case. Misuse can lead to serious health problems like dehydration, dangerous overheating, and even long-term effects on brain function. Another critical point is the difference in purity between Molly and street ecstasy. Molly tends to be purer, but since the market isn't regulated, the chemical makeup can vary widely. This variability can significantly impact both safety and the overall user experience. So, being aware of these factors is essential for anyone considering use. Depressants include several types of drugs such as barbiturates, sedative hypnotics, and anti-anxiety medications, with benzodiazepines being a common example. Medically, these are prescribed to help manage conditions like anxiety, sleep disorders, and seizures. However, because they produce calming and sometimes euphoric effects, they have a high potential for misuse. Abuse often involves taking larger doses than prescribed or mixing these drugs with alcohol, which significantly increases the risk of dangerous side effects like respiratory depression and overdose. One of the most concerning aspects is how quickly dependence can develop, making withdrawal symptoms quite severe and difficult to manage. This combination of factors makes depressants particularly risky when not used under strict medical supervision. Depressants are sometimes misused in sexual assault cases because they can sedate victims and cause memory loss, making it easier for perpetrators to harm them without resistance or recall. Common drugs involved in these situations include Rohypnol, GHB, and certain benzodiazepines, all of which can incapacitate a person quickly and discreetly. To prevent these crimes, Public awareness campaigns play a crucial role by educating people about the risks and encouraging safer social environments. Being vigilant at social events, watching out for suspicious behavior, and looking out for friends is one of the most effective ways to reduce these incidents. Additionally, it's vital to have strong medical and legal support systems in place to help survivors recover and to hold offenders accountable, reinforcing a safer community for everyone.